Hi, my name is Chase, and welcome to the Wellness Center podcast, where we're going to talk all things red light therapy. Thank you so much for tuning into this episode. Please make sure to like and subscribe so you can get updated and notified on all of our newest episodes that we'll be releasing. Have a great rest of your day and enjoy the episode. Hey everyone, this is Chase, and welcome back to the Wellness Center podcast. I hope everyone's been having a really good day and week, and I hope the new year's been treating you well, and the snow and the life and everything is going good. I had a fun opportunity this weekend, just to give you a little update about my life. I got to go snow caving with a couple of dear friends of mine over the weekend. So we got to go up into a canyon, and we found a big pile of snow, and we tried to dig it out, and it didn't work out too well, but we ended up spending the night out there anyways. A lot of fun. I'm tired. So I'm going to get right into it today. I'm going to try and keep this podcast pretty quick. I like to keep it under 10 minutes just so it's easy to watch. You can watch it on your commute or anything like that. If you haven't already, please make sure to hit the like and subscribe button so you can get updated on all of our most recent stuff. And again, like always, this is my camera. This is my computer screen. So I'm looking over here, I promise. I do love you. I'm just looking over here. All right. So today we get to talk about temporomandibular disorder. Increase the size of this because I know you can do that. So temporomandibular disorder. What is temporomandibular disorder? So according to Hopkins Medicine, temporomandibular disorder are disorders of the jaw muscles, temporomandibular joints, and the nerves associated with the chronic facial pain. Any problems that prevent the complex system of muscles, bones, and joints from working together in harmony may result in temporomandibular disorder. Oh, pain up in this area, or anything that stops you from functioning in that aspect. Now, right to the study, we are here on Springer Link. We're looking at BMC's oral health article. This was published in February 13th of 2023, so about 8 days ago. And the topic at hand is the reliability of using light therapy compared with laser in pain reduction of temporomandibular disorders, a randomized controlled trial. So let's go over the background, the materials, the methods, the results, and the conclusions. So the background, temporomandibular disorders, referred to as a group of symptoms where pain is the most leading cause to demand a treatment by the patient. Light therapies are of great importance at current times due to its biosafety and non-invasive quality when used for the management of TMD symptoms. So again, biosafety and non-invasive quality of stuff. So again, it's not a surgery, it's just light. It's like standing out in front of the sun. And biosafety, there's little to no adverse side effects with red light therapy. The most common things that we see is people sometimes getting a small headache or a little nauseous. And that's if they are using a protocol that's too strong for what their body can handle. We dial it back a little bit and that symptom typically goes away. But what they say in a lot of science is there's little to no adverse side effects with red light therapy. Whereas in most Western medicine, medical prescriptions and medications and all that kind of stuff, on average, have anywhere between 10 and over 100 different negative side effects. Seed. This study aimed to evaluate the efficacy of red light with low-level laser in treating TMD patients. Materials and methods. A double-blind, randomized clinical study was conducted and included 60 patients along with 3 different groups, 20 per group. So 3 different groups, 20, 40, 60, presented with myofacial pain related to TMD. So pain in the face related to temporomandibular disorder. Patients were randomly divided into the 3 groups. Group A were managed by applying the LED light device into the trigger points without switching the device on. They just put it there and didn't turn it on. A red light was given to Group B for 5 minutes at the tender muscles. Group C were treated using low-level laser therapy for 30 seconds. So again, Group A, placebo. Nothing really happened. Group B, they were given and the people had to do it. Group C were treated, but only for 30 seconds by the facilitators or healthcare professionals that are doing the study. Patients were evaluated for any improvements regarding the pain score, presence of trigger points, and that word along 4 visits, 1 week interval between each visit. So they only did 4 sessions, which is surprising to me because most times, most studies that we see, people are doing 3 to 4 sessions or 2 to 3 sessions a week for multiple weeks on end, for 5 or 6 or 7 or 8 weeks. So this is they haven't done they didn't do a lot of stuff here. And 1 time a week is typically something that we say maintains. It doesn't get rid of pain. So I'll be interested to see the results on this one. Just kidding, I already read the study. I know the results. Both groups B and C patients showed a statistically significant improvement in the pain value in the third and fourth visits when compared to group A. So first and second visits, first 2 weeks, they didn't notice anything. Again, that's just another testament that it takes time. And sometimes, because this really what it does is it promotes the body's natural ability to heal, and it expedites that process by stimulating the mitochondria in every single one of your cells. So again, it's pretty common that people aren't noticing results until that third or fourth week. A lot of people don't, especially here at the Wellness Center. You know, it typically takes what we tell people on average 6 sessions. Regarding tenderness, there was a reduction in the number of trigger points in both study groups. However, the results were insignificant in Group B. Statistics showed insignificant decreases between Group B and C patients regarding pain and number of trigger points at all visits. So B and C were pretty similar. So the conclusion, both LED light and laser therapies could effectively relieve pain associated with myogenic TMD. And there were no important differences between their outcomes. However, the biosafety and lower cost of LED light device compared to the laser should also be considered. What we have is an LED light device. We have over 14,000 LEDs that pulse light at different wavelengths and frequencies depending on the protocol. So what we have is pretty cool. Kind of like the highest, there's so many high-end cars. It's the Cadillac, it's the Porsche, it's whatever high-end car you think is high-end. It could be the Acura TSX for all I care. All right. At-home remedies. So we're looking at healthline.com and we're understanding TMJ, TMD, temporomandibular joints. It's a part, TMJ is a part of TMD. But here is exercises for TMJ pain relief. Strengthening jaw muscles. You can get stuff online, like on Amazon, that's like little chewer things that help like strengthen your jaw. You can do, you can stretch the jaw, you can relax the jaw, you can increase jaw mobility. You can reduce jaw clicking and you can promote jaw healing. A relaxed jaw exercise is just allowing your jaw to relax. Goldfish exercise, partial opening, full opening with your hand, chin tucks, resisted opening of the mouth. So a lot of different ways you can strengthen these muscles. Resisted closing of the mouth, tongue up, side to side jaw movement, forward jaw movement, moving your jaw forward and back. And again, I mean, there's a bunch of different stuff you can do. If you want to see some more of these, you're welcome to come to healthline.com and look up TMJ. Well, that's all I got for you guys today. It's a great podcast, really simple stuff. So again, red light therapy works. It's a proven treatment plan to help with a lot of different pains that are both physical and mental and or emotional. I hope everyone has a great rest of your day. I hope everyone is staying safe in this cold weather, especially if you're here in Utah. Again, like and subscribe. I post stuff weekly. Have a great rest of your day. Peace out.